I can hear you. Can you hear me? Okay, cool. I'm Buffy Jameson. I am a co-founder and co-chair of the Iowa Queer Communities of Color Coalition.
Santiago?
Hi, good morning, everybody. My name is Santiago. I work with Iowa Workforce Development with the Migrant Seasonal Farm Workers side, and I'm actually located at the Waterloo office.
Luis?
Hi, everybody. I'm Luis Lona. I work with Iowa Legal Aid from the Cedar Rapids office.
And Maggie?
Hi, my name is Maggie Haran. I work with Indian Hills Community College in Ottumwa in the Gap and Pace program.
And finally, I have Lisa. Lisa's phone. We can't hear you if you're typing, Lisa. Okay, did I miss anyone else?
Hey, good morning, everybody. My name is Olga Esparza, and I'm with Iowa Total Care. And we serve the entire state of Iowa, but I'm located in Des Moines.
And I finally have my microphone. I'm Janet Tanner. I'm with Central Iowa Works, and I'm here in Des Moines.
Thank you.
And also Melissa Garcia. I am with Iowa Workforce Development and oversee the Migrant and Seasonal Farm Worker Program, and then foreign labor also for the state.
And I'm over here at One Iowa. My name is Max. My pronouns are they, them, AEA, and he, him, L. And I'm just excited to be here. Thanks for having me.
Thank you.
Good morning, everyone. My name is Catherine River, and I am with the Spanish Helpline as a Rice Americos member. And right now I'm working from Ames, Iowa.
Perfect. And on the chat, I have Paula Plasencia from West Des Moines, and she works at Dowling Catholic High School. We also have Marlua Barca with pronouns she, her, and ella, they, them, and ella. And Marlua is with Des Moines Public Library. And Melissa Cano from Luna, and she's in Des Moines as well. And Chelsea, healthcare manager with Proteus. And B. Sanchez with Mid-Iowa Community Action in Des Moines. All right, well, thank you everyone for introducing yourselves and keeping it brief so we can move on to our amazing speaker that we have today. I am recording the meeting, that way for those who are not able to attend, they'll be able to watch the recording. I'm happy to introduce Anna Coppola with the Polk County Health Department. Thank you so much, Anna, for giving us an hour of your time to talk about the COVID vaccine. So take it away.
Thank you. Can you hear me? Good. Well, good morning, everybody. Very happy to be here, and thanks to Sonia to inviting me to this huge group. I didn't expect this amount of people. This is awesome. So my name is Anna Coppola. I work for Polk County Health Department. I am public health, public health planner. But since the pandemic started, I have been just taking a role on the coronavirus. And now since the starting of this year on the vaccine. So I think that that is what you guys want me to bring to you today. I am going to talk about what is the vaccination program. I'm going to talk about the phases, and then I'm going to give you with, I'm going to take some takeaways for you. I do, you guys are leaders in the community, so I hope that this information I provide to you, you share with your community, with your staff members, with your clients, because that is what people need. People need to be informed, and people need to have reliable and clear information about what is happening with the vaccination process. So I'm going to go ahead and start. So as everybody knows, the Advisory Committee on Immunization Practices issued a recommendation to use Pfizer and Moderna COVID-19 vaccines. And this is with the purpose to prevent the coronavirus. So the Food and Drug Administration for the emergency use authorization of these two vaccines that are recommended and authorized, only these two right now. If you have seen the news, there is a news today that Johnson & Johnson FDA said that it looks good, but they still have to go through the process of being authorized and recommended. So let's talk about these two. The Pfizer vaccine is for people 16 and older. The Moderna vaccine is for people 18 and older. Children and adolescents outside of these age groups should not receive COVID-19 vaccine at this time. Persons should not be scheduled to receive the second dose earlier than recommended, meaning for the Pfizer vaccine, we have 2 doses, and the first one and the second has to be 21 days apart or 3 weeks. For the Moderna vaccine, also 2 doses, and the first one and the second should be 28 days apart or a month. The second dose should be administered as close as the recommended interval possible, so those 3 weeks or a month. However, if this is not feasible to adhere to the recommended interval and the delay of the vaccine is unavoidable, the second dose of the Pfizer and the coronavirus may be administered up to 6 weeks. So 42 days is the maximum that right now the researchers have set. That is the longest time to apply the second dose. There are currently limited data on the efficacy of the vaccine administered beyond this window. So we really don't know what happened after, if it happens that either or those vaccines, the second dose, don't get applied on that interval of 42 days. But there is not, what the researchers know is that there is no need to restart the series. So it happened that we don't have enough vaccines, and I have my second doses, for example, my time is the 28th of February, but happened that because there is limited of vaccines, it has been the 12th of March, for example, and I haven't got it, so that I don't need to restart when it's available, the first doses and the second doses. Now, what is happening in Polk County? If you live in Polk County, in Des Moines, we have been on the news because we have given 14,000 people who need to receive their second doses of Moderna. And we have received Pfizer vaccine, but not a large allocation of the Moderna vaccine. And those 14,000 people that I'm talking about are people that need the second dose of Moderna. So there is a delay for the public in receiving this second dose of Moderna. But the CDC states that the timing of the second dose will compromise the effectiveness of the vaccination, meaning the research shows that the first dose alone provides 80% effectiveness in preventing COVID-19 infection. Now let's talk about what about those that have had COVID-19 in the past or in the present, and it's time for them to have their vaccination. So data for clinical trials indicated that the COVID-19 vaccine can safely be given to persons with evidence of prior COVID-19, meaning if you had COVID-19 6 months ago, if you have COVID-19 a month ago, it is very important that the vaccination should be offered to persons regardless of history of symptomatic or asymptomatic infection. And doesn't need people that wanted to have the vaccine, they don't need to have a testing to assess the acute infection to make a decision of getting or not the vaccine.
Anna, can I ask a question?
Yes.
On what you just said. So correct me if I misinterpreted what you said. So anyone who has had the virus, who's tested positive, they're able to get the vaccine?
Correct. Yes. Everybody that have had COVID-19, the only requirement is that they are out of symptoms, or if they are asymptomatic, they are out of that isolation period.
Thank you.
Vaccination of persons with no of current COVID-19 infection should be postponed until the person has recovered from the acute illness. So if you had COVID right now, you shouldn't get the vaccine now. You should wait until, again, you are you have no more symptoms, or you are out of that isolation period. While there is no recommended minimum interval between infection and vaccination, current evidence suggests that the risk of COVID-19 reinfection is low in the months after the initial infection, but may increase with the time due to waning immunity. Entonces, sorry. Thus, while vaccine is limited, people that have recently have the infection, the virus, may choose to delay temporarily, if desired, the access to the vaccine, just because the research show that if you have COVID-19, you have like 3 months or so with those high antibodies. So you are, your body have created those antibodies and you are protected. For vaccinated persons who subsequently experience COVID-19 prior receipt of a vaccine should not affect the treatment. So if I had my vaccine today, but tomorrow or this afternoon, I start having symptoms of the coronavirus, so I should keep the treatment of the COVID-19. Persons in the community or outpatient settings who have had COVID exposure should not seek vaccination until they finish that quarantine period. The COVID-19 vaccines can be administered to persons with underlying conditions. There are no contraindications to getting vaccinated. Clinical trials demonstrated similar safety and efficacy profiles in persons with some underlying conditions compared to persons without underlying conditions. So people with diabetes, high blood pressure should be receiving the vaccine and don't stop getting the vaccine and making the decision to get the vaccine just because have a chronic condition.
Can I have a question? Can I make a question to you, Anna? You're talking about those type of conditions for certain people that have like diabetes. Are those people available to receive the vaccine even if they are not under the age that we are vaccinating people right now?
No. That's a very good question, Yvonne. No, we need to go through the requirements of that IDPH have released to people get vaccinated. And I'm going to talk about those phases in a little bit. But we need to go through those phases. So in general, this is when it's time for you, or if I'm 65, right? We are vaccinating people 65 and older. So if I'm 65 and I have diabetes, I can go ahead and get my vaccine.
And there's another question, Anna, on the chat from Paula Plasencia. Are the symptoms of COVID the same as the reaction to the COVID vaccination?
No, absolutely not, because the vaccine is not a live virus. So the vaccine is only a protein that is going to spike the cells in our body to realize the organism, to the body realize that there is something weird in my body, something different, and I'm gonna start develop those antibodies. Now, studies in pregnant people are planned and getting the vaccine. The clinical trials show that it's unlikely to pose a risk to the pregnant person or the fetus because the vaccine is not a live vaccine. So the vaccine is degraded quickly by normal cellular processes and does not enter to the nucleus of the cell. However, the potential risk of the vaccines to the pregnant person and the fetus are unknown because these vaccines, the Pfizer and the Moderna, haven't been studied in pregnant people. So we don't have enough research to say it's going to be fine as, for example, as I mentioned earlier, it's going to be fine, the Pfizer for people older than 16 or 16 and older, and the Moderna for 18 and older. There are no data on the safety of COVID-19 vaccines in lactating people or the effects of the vaccine on the breastfed infant or the milk production. So vaccines are not thought to be at risk to the breastfeeding infant. A lactating person who is part of a group recommended to receive the vaccine for example, right now we are vaccinating people, teachers, or people in the education sector. So if I'm lacting, it is recommended for you to receive the vaccine. Adolescents age 16 to 17 are included among persons eligible to receive the Pfizer vaccine. While the vaccine safety and efficacy data in this age group is limited, there are no biological likely reasons for safety and efficacy profiles to be different than those observed in the 18 population, 18 years of age and older. Now let's talk about phases of the vaccination process. So,
Anna, can I ask you a question from an
yes.
attendee?
Yes.
Are there any foreseeable long-term side effects, risks associated with the vaccine?
No, there is not until now. There is no long-term effects associated with the vaccine. We don't know either if this vaccine is going to be a vaccine that you have to have every year, like the flu vaccine, or every 10 years, like the tetanus vaccine, because we need to be clear with you and the community. This is a new vaccine. This is a vaccine that was developed because the pandemic that we are living. We haven't had pandemics in 100 years. So it's not something that it went through a really quick process. Usually the vaccines are developed in 12 years, one vaccine, or 15 years even. And even with that, some of those vaccines don't get authorized or recommended by the FDA. So the truth is that we are learning. The Pfizer, the Moderna, the other vaccines that are in clinical trials, we are learning to see how this works. So if you don't have more questions, I'm gonna move to the phases of the vaccination. Okay. So the state of Iowa announced the availability of the vaccine to individuals and the priority designated by phases. So when we started the vaccination program back in January, we started with the phase 1A. This 1A included healthcare providers and long-term care facility residents and staff. Now in February, beginning of February, we moved to phase 1B. This phase 1B is huge. So in the first line, we have people 65 years and older. That is like our priority group. But in this same phase 1B, because the remain of the supply of the vaccine, IDPH implemented a tiered population for the following populations. And those that are at higher risk of exposure and severity of the illness. So tier 1, right now we are doing that here in Polk County. The tier 1 is first responders. So those are firefighters, police officers, child welfare social workers. Also in this tier 1, we have, as I mentioned it, staff and teachers from pre-K to 12, early childhood education, and child care workers. And then we are going to move to tier 2, which is individuals with disabilities living in home settings and that are dependent on attendant care staff. Also in tier 2, we have those frontline essential workers in the food, agricultural, distribution, and manufacturing sectors who work or live in congregated settings that are not allowed for social distancing, such as workers in the meat packing or manufacturing production line, or migrant workers who live in bunk room style. Then we move to tier 3. Those are a staff of individuals living in congregated settings not covered by Section A or B, including shelters. Also in tier 2, we have government officials, including to ensuring the continuing of the government. And then we have tier 4. Those are inspectors responsible for health, life, and safety, including those in the hospital, long-term care settings, child food production safety. And then the last tier of phase 1B is the correctional facility staff and individuals incarcerated, including state, county, and city operated facilities. And then we will move to phase 1C and etc. We don't even have that information yet. So IDPH should conduct periodic reviews of vaccine characteristics, vaccine supply. As I mentioned, we have now 2 vaccines that are recommended and authorized in the United States, but it looks like the Johnson & Johnson is having a good outcome. So it needs to go through the process with the FDA to see if pass the authorization to give it to the community. So IDPH will periodically reassess when to expand vaccination to other priority populations as supply increase, demand changes, or information on the epidemiology and impact of the pandemic changes. If you have seen, there are the positivity rate of the coronavirus cases has been going down. So we are learning. This is a pandemic. We haven't lived in a pandemic before, and we are just learning.
Anna, I have a question for you. I'm sorry to interrupt. You are giving us all the tiers and the phases that we are going through in order to get vaccinated. My question is, do you have any idea, and maybe you don't have the answer of this, but what I saw, as you mentioned at the beginning of this conversation, that right now we are out of the second doses and people that are 65 and older are waiting for the second doses to come. Do you expect that all the tiers are going to be on time? What they are talking about, I know it's a difficult question. I work for a community college, and we work with students, and I was wondering, I saw the chart and I saw that we are in tier 5. So what is the meaning of that? Are we going to be able to get the vaccine by the end of the 2021, the beginning of 2022?
Yvonne, it's a very difficult question. And what I know is well, first, we have second dose vaccines for the people that are 65 and older, for the teachers or the people, staff in the education sector. For those first responders in phase 1B, tier 1, which is the ones that are vaccinated. The problem is that we are not receiving enough vaccine, and we have a lot of people that have been vaccinated with the first dose and needed to be vaccinated for the second dose. So that is our priority right now. For what I know, we are going to continue with the vaccines that we keep receiving from the federal government. We are going to continue vaccinating the people that need second dose. By April, we think that we are cover those second doses for tier 1, and then we can move to tier 2. So I really don't have a time for you, but what I have heard on the news, and you probably guys have heard it too, Dr. Fauci have said maybe the fall, we may have herd immunity. So that means that maybe 70% of the population had been vaccinated. So I'm assuming that by that time, for example, people that are in the tier 5 may have gotten the vaccine. And we're gonna get more vaccine. We're gonna have other vaccines, not only the Moderna and the Pfizer. So hopefully it's gonna be better. We just need to be patient.
Thank you, Anna.
There's another question in the chat. Would childcare workers who work from home or have in-home childcare centers qualify for the vaccine?
Yes, you are qualified for the vaccine right now. You are in that tier 1 of pre-K-12 school staff, early childhood education, childcare workers. So look for places to get vaccinated. We are partnering with clinics. So one suggestion is talk to your healthcare provider. We are collaborating with pharmacies to get the vaccine out. Here at the health department, we are vaccinating too. So there are some options out there.
Thank you. And another question, someone's participant's mom who's 94 is having a hard time getting the first vaccine. So any suggestions on how family members can help?
Yes, absolutely. So because that person is in the phase that we are vaccinating right now, that person is a priority. So again, you need to follow up with pharmacies, Medicap, Walgreens, CVS, Hy-Vee. Here at the health department, we also have a service line that you can call, and you can give your name, phone number, and they will find out a time for you to get the vaccine. So that phone number is 515-323-5221. 515-323-5221. We also have the language at that center. So people that speak other language that English can be helped too.
Thank you, Anna.
So right now, I think I'm gonna move to the takeaways. So I would like you to, as leaders in the community, to push this message out. The COVID-19 vaccination is effective and is safe. Millions of people in the United States have received the vaccine under the most intense safety monitoring in US history. CDC recommends you get the COVID-19 vaccine as soon as you are eligible. As of today, 595,600 doses of COVID vaccine have been administered in Iowa. In Polk County, 65,600 have been administered. The first dose, or the people that have received first dose, are at 43,783, and people that have received the second dose is 21,816. The other point that I want to take with you, I want you to take with you, is building trust and confidence. We really need to talk about the truth about the vaccine and give a clear message about what is the vaccine. Trust is a foundation to a success vaccination effort. Connection between that connection that you have with your community is very, very important for that trust and to reach that point of health equity. To find credible and clear information in Spanish, the health department has developed misaludiowa.com. You can find accurate, clear, and up-to-date information there in Spanish, or you can visit the health department's, Polk County Health Department's website. And the third takeaway I'm gonna give you is be transparent in the communication. Provide clear and accessible information on vaccine safety and benefits. Promote vaccine confidence among champions. Address misinformation and engage community with trusted messengers. You guys are leaders in the community. You guys are those messengers that are out there talking to your clients, to your, I don't know, students, people that you can reach out to. So you are very important for us to get that information out. Getting vaccinated yourself may also protect those around you. It's not about just me. So it's kind of kindness, you know, because I'm protecting myself, obviously having the vaccine and using those public health preventive measures, but I also protecting the people that are around me. We need to understand that even if you get the vaccine, to be able to get to the end of this pandemic, we need to keep wearing the mask. We need to keep socially distancing. We need to avoid crowds. We need to stay home if you are sick. Vaccines will work with your immune system, so it will be ready to fight the virus if you are exposed. So I don't think I mentioned it, that Pfizer vaccine has 90% efficacy, 95% efficacy. And then the Moderna vaccine has 94.5% efficacy. So they are really good vaccines. I mean, I think that the flu vaccine is only like 60 or 70%. So we have those that 5%, right? To be able to have completely cover. But if you get the vaccine and you have been vaccinated, the illness is not gonna be that hard as you are not, if you are not vaccinated. That's all for me. I don't know if you guys have any other questions.
I have a question, Anna. Sorry. I have actually two questions. One will be more than a question, a comment, just to make sure that you are planning on give information out there whenever there is, you know, I heard complaints about people that are getting the vaccine right now. I'm talking about 65 and older that went to the second appointment and no one contact them in order to let them know, oh, I'm sorry, we don't have the second doses for you. You need to reschedule. So I think it will be very well deserved for all the community out there to know whenever there is this type of issue. That is one comment that I heard from a lot of people not having the second doses and nobody informed about that. And then to as well, this information that you provide to us is amazing. I appreciate it a lot. And I think there is a lot of confusion with people having diabetes, asthma, or and they are not into the tier that we are vaccinating right now. So that is something that we need to share as well. Thank you so much for all the information, Anna.
Okay, I have a few questions that are in the chat. The first one is it still necessary to wear a mask or social distance after you have been vaccinated?
Yes, the answer is yes, because we don't have enough vaccines. So all the people that we want to be vaccinated and reach that herd immunity, we are not at that point yet. That's one reason. The other reason is that we have seen that there are variants of the vaccine, of the virus, I'm sorry. So we don't know yet if the two vaccines that are available, recommended and authorized right now, the Moderna and the Pfizer, are going to protect us with those new variants.
And the other one is, are vaccinations administered regardless of citizenship status?
Absolutely. Good question. I'm glad you guys asked. The vaccine is available for everybody in the United States. The vaccine doesn't have any cost. It's free from the government. So people that are undocumented, they need to be educated. They need to learn this because those are the people that need it the most.
Thank you. And the other one is, what are some of the doubtful things being said in our community that are causing people not to get vaccinated?
So there are some myths about that the vaccine has a chip that are going to follow them because you get the vaccine. So there is a fear there. There is also, I have heard that the people have heard or in the community that the vaccine is made from abortion parts of babies. So that is obviously related to Christianity or some religion. So obviously all these things are not true. I have presented to several organizations and I'm trying every time that I go and talk, being very clear and concise and provide this reliable information that is really not true. Regularly, this kind of information is coming from the country of origin, Mexico or Peru or Colombia. that they are talking over there about the vaccine. So yeah, all those things, we need to talk about it.
Another question is, so communities of color and queer communities have historically been discriminated. Do you know what is being done, if anything is being done, to make sure that those communities who don't trust the healthcare system, get the information and get vaccinated?
Yeah, I think that is, I would love to talk to that person, if it's Max or any other person from the organization, because I am not doing anything about it, and I would love to. I'm reaching out to the Latino community, but I know that all the discrimination that has been against this community, and I would love to provide some information or facilitating conversations with them.
Thank you. Okay. And that's one of the reasons why we are here today, to get this information out to all of you who are service providers. So because a lot of the people who we work with will trust us when we say something, instead of the government. I shouldn't say us, because I'm also with government, but you all who work directly with the community, you already have the trust with the communities. So I'm so thankful that you guys, that you are all here to share this information. Did you have something to share, Buffy?
Yeah, so I was just saying, I was probably one of the people who asked a similar question. I'm guessing I'm not the only one. So yeah, I would love to talk to you more about that. And also, I just kind of want to point out that, I don't know, like sometimes we need more buy-in, because I'm trying to figure out, well, I still have a lot of questions that I know members of my community have, because I've had these conversations before. So how am I supposed to answer that? I don't want to go out and say, oh, definitely get the vaccine, without having that back knowledge to be able to say, oh, okay, well, yeah, that did happen. And that did literally happen last year, where the government started opening everything back up when the statistics about people of color and poor people came out. Right? So, this stuff is ongoing. So if there's nothing being done systemically, I'm trying to figure out how I can actually help to bridge it, because there's a discrepancy there. You see what I'm saying?
Yeah, and there has always been that discrepancy in, from government to the communities. Yeah, we can definitely chat.
Yeah, and I think that we need to go back to history and really talk about what had happened to these communities, and why is that distrust, and what is that don't be willing to hear from healthcare providers or the government. So it is a work that it has to be done, and you guys are the ones that have to speak up, and I'm here to help as well, Sonia.
Thank you. Another question is, when will emergency homeless shelters who have been open on the front line begin to receive vaccines for staff? There are mixed messages about this.
So my understanding is that is tier 3. It says staff of individuals living in congregated settings, not covered in sections A and B. So including shelters, sober living homes, behavioral health treatment centers, detention centers.
Thank you. All right, any other questions? Those are all the questions I see on the chat.
I have a question. Buenos dias, Ana. I guess my question is more curiosity. Do you have any information if the vaccine, the COVID vaccine, may help or if it may impact, after effects of those who have already had COVID. So like I had COVID back in September and I still can't smell. I still have back pain, and I know there's other people that share similar effects as I do. So do you know if there's, I mean, I know the data is still new, the research is still new, but do you know if the vaccine may help alleviate some of those effects or?
No, Abby, that's a very good question. And the truth is that I don't know. What I do know is that people that are being vaccinated right now, the 65-year and older, they are not having as much of side effects as. So I didn't talk about the side effects, but for the first dose, maybe it is just, a little pain in your arm. But for the second dose, most people get like chills or tiredness for 1 or 2 days. It shouldn't be more than that.
Talking about the vaccines and the reactions and the death, it's nice to know.
Yes, it's nice to know.
Go ahead,
So
Anna.
I'm sorry, Abby, but I don't have an answer for that.
But just so you all know, there is post-COVID clinic in Iowa City that is seeing people who continue to have symptoms after months after they have had COVID. So if you're interested, let me know and I can send you that information. All right, we have 2 minutes.
This is Vanessa.
Oh, go ahead.
Go ahead, Vanessa.
Maybe a quick question. So you mentioned that those who receive, attendant care, like in the homes, are part of the priority category. Has there been any efforts, or what is the process to ensure that those who are vulnerable and aren't able to go to a physical location to get the vaccine are able to get that vaccine? Like, are people going to their homes to provide the care attendants the vaccines along with the person in their home? Or what's the process for this?
See, we call those unbound communities or individuals. So we are in the process of figuring out how we are going to send, a nurse, just to be very simple, to those homes that people are in to get vaccinated if they are in the phase that we are vaccinating right now. But again, remember that as much as we want to vaccinate everybody, the problem is that we have more people to be vaccinated than the vaccine that we are receiving. So there is that gap.
So I had a
Thank
question,
you.
this is Carissa from DRI, that kind of piggybacks on what Vanessa was asking. So when you were doing outreach at all levels for individuals like in nursing homes, there was direct contact made with nursing homes in an effort to vaccinate in those settings. Are we going to see the same thing with facilities that like Mosaic and things like that are running group homes of highly vulnerable individuals? Or are we going to be expecting those individuals to try to coordinate this on their own through their barriers?
For what I understand, there is going to be a communication with those organizations that serve this specific community. If you haven't received a communication yet, I will suggest you can reach out to me and I can send you to the right person that is collaborating on this effort.
Thank you.
All right, that is all the time we have, everyone. Anna, thank you so much for bringing us this information. I know that you have been out there talking about this, and I know that this is on top of your job and what you already do. So it's so appreciated. And thank you for answering all of our questions. I'm sure we will have a lot more coming up.
No, thank you very much, Sonia, for inviting me to talk to you. As I mentioned, you guys are leaders in your community, and we need you to push this message out. So thank you for the invite. Very nice to meet you all, and have a good day.
Thank you, everyone. See you next month.